We have Professor Melanie Davies from the University of Leicester, and she's going to do a presentation on the Midlands Diabetes Project. After she's done the presentation, my co-chair, Chris Weiner, he is going to lead a conversation, which will be part of, and we'll have some breakout sessions to explore some key questions pertaining to today's event. So Melanie, welcome.
Thank you very much.
And the floor's yours.
Okay, thank you very much. And I just hope that I can share my screen and that you can see my slides.
Yeah, we can see your screen. That's good. Yes, okay. Well, yeah, brilliant.
Perfect. Okay, so look, it's a real pleasure to be able to discuss with you some work that we've been doing with Midlands Engine Health and the Midlands Health Alliance in collaboration with colleagues across the Midlands and Novo Nordisk, who are one of the pharma companies that are very active in the management of diabetes and obesity. So this, just to give some context here, so I'm a professor of diabetes medicine, and we'll all know, those of us that are doing clinical practice, that diabetes is on the increase, particularly type 2 diabetes. So 9 out of 10 people who have the condition have type 2 diabetes, and the numbers are increasing right across the globe, particularly in younger people now. And we know, for example, that in the UK, about 4.7 million people have diabetes. As I've said, 9 in 10 will have type 2. About a quarter of people going into hospital with heart failure or heart attack or stroke have established diabetes, and we know that it accounts for far too many, for example, amputations. As well as having a huge impact on people living with diabetes, it has an impact on cost as well. About £10 billion a year is spent on diabetes, which is about 10% of the entire NHS budget. And nearly all of that is spent on the complications of diabetes. The other thing that I should say is that type 2 diabetes, as well as clearly affecting older people, is increasingly affecting younger people. So 10 years ago in the clinic, it would be rare to have children with type 2 or even people in their 20s and 30s. Now it's very common. We have literally thousands of people in their 20s and 30s with type 2 diabetes. Those people have a higher burden of complications, and that's likely to have a burden on their families and the healthcare system. So as I've said, about 80% of treating is on complications of diabetes. There's a very, very close link with obesity, and that's why I think that's increasingly important. There's also a close link with socioeconomic deprivation, and also in many populations are impacted more by type 2 diabetes than others, particularly, for example, in Leicester, the South Asian community are particularly impacted. The COVID really starkly demonstrated the disproportionate impact of both obesity and socioeconomic deprivation, and also type 2 diabetes. So people living with type 2 diabetes, and particularly those who were obese as well, had a disproportionate mortality due to the COVID pandemic. So we've been doing some work in the Midlands, and we know, for example, that 1 in 13 adults in the Midlands has diabetes. Every week, around 2,000 cases of heart failure in England, including 4,420 in the Midlands, are contributed to by diabetes. And we know that if we look at the Midlands Engine observatory data, that just from an economic perspective, improving the management of type 2 could have huge economic as well as very clearly personal benefits. And it should really be part of our levelling up agenda, because we are disproportionately impacted in the Midlands. But equally, I don't have time to go into this, but we have a very rich infrastructure of research, of world-class research hosted in the Midlands across our partners. and we're very well placed to come up to some of the answers to this issue. So in July 2021, Midlands Health Alliance and Midlands Engine and Novo hosted a roundtable discussion. We brought together clinical experts and partners really from across our region, and really developed this, what we call a blueprint, to really try and think about how we can harness the expertise that we have, the opportunities that we have to really improve outcomes for people living with diabetes, but also to improve the wealth and health of our economy in the East Midlands by tackling this really important issue. So this is the approach that we have articulated. It's a starting point for discussion. We wanted to really come up with 3 pillars. One was around clinical research. We know that if we do research better, it can help to improve outcomes for patients, but it also brings expertise and retains expertise into our region and really harnesses what we already have. We know that if we can focus on prevention, as I've said to you, much of the cost to people living with diabetes and the cost to the economy is focusing on the cost of complications. So if we can identify and prevent type 2 diabetes earlier, particularly focusing around obesity interventions, that may be useful. And also we need to improve the treatment and care that people living with diabetes are offered, and working in innovative ways, not just in the medical setting, but across the whole setting. So we highlighted a number of recommendations. One is around using regional research networks to develop frameworks to really allow us to harness potential from new ambitions that the government has about putting clinical research at the heart of the NHS, and being able to run innovative, efficient and high quality clinical research. Understanding, we already have done some work on this, but continuing to understand the unique strengths and characters of our region, which really allow us to inform priorities and understand our local population needs. And certainly in our ICS, we've been working really closely with them to help to articulate that, to make sure that we get a fair share in the regional and investments. There's lots of investment of NIHR into state-of-the-art research structure and infrastructure, but still there is inequality in how that funding is allocated, and we don't do as well as some of the Golden Triangle centres, and we really need to look at how we can increase the investment to serve our underserved communities and really address health inequalities. That we undertake research to understand, improve the understanding of diabetes and obesity as chronic conditions, and to try and improve resilience against future pandemics, as we know how much type 2 diabetes and care has been impacted. Prevention recommendations about understanding specific risk factors, mobilising community partners, particularly there is some really good work going on in the region about working with community centres, sports clubs, faith centres, councils and public health to really mobilise that true wide social care and public health teams, engaging and working with employers as well as a number of treatment and care recommendations, identifying those groups that are at highest risk, developing robust processes to make sure healthcare professionals are able to support people living with diabetes, and also, as I've said, working with community partners and making care accessible to all of our populations. Finally, identifying and seizing key moments of contact with NHS services, particularly around effective self-management. And very pertinent to the meeting today is around the opportunity to work really closely with the ICS to really work with treatments right across the interface to benefit people living with diabetes. So that's it in a nutshell. There's a lot more to it than that, and I'm happy to take any questions, but I think it's an exciting and very topical piece of work that's been ongoing with the Midlands Engine and the MHA. Thank you very much.
Thanks so much for that, Melanie, for that presentation. I think I would suspect that every single ICS has got diabetes as its priority. And I also suspect that we need to target resources and awareness campaigns and the use of science, technology, and role of clinicians, isn't that as well? So, any questions for anyone, please? I've put in the chat, by the way, a chart that was launched at the NHS Confederation Conference last week, looking at the needs of Black and minority communities and diabetes. I actually was asked to chair the working group to develop this charter, and I'm hoping that a number of ICSs will adopt this charter as part of their thinking around how they engage with communities, look at issues around data, etc. So, any questions for Melanie?
So Patrick, I probably just want to say that I didn't have time to go into detail, but clearly in the Midlands we have huge innovation and support around so the Centre for Ethnic Health Research that's hosted within Leicester as part of the ARC. We've worked really closely with them, and that's clearly one of the major strengths, I would suggest, of some of the work that is going on in the Midlands.
Okay, thanks for that as well. So any questions from anyone? Any particular questions for Melanie? You can't be all experts on diabetes. Okay, we've got a couple of hands going up. We've got our host, Alex.
Hi, Melanie. Thank you for a great presentation. I did a little pitch at the beginning about MIH, and I just wondered if you wanted to do a round off for Midlands Health Alliance. Ian referenced it, and you have as well, but we haven't really given it any time. So if you just wanted to do a few sentences on Midlands Health Alliance.
Yeah, so I think the Midlands Health Alliance was, there was two organisations really that are important. The Midlands Innovation Health, which is really bringing together the universities across the Midlands, and Midlands Health Alliance, which was really trying to harness the major strength we have in research infrastructure in the NHS. So we have our clinical research network, which sort of holds everything together, but we also have the clinical research facilities and also biomedical research centres in Birmingham, Leicester and Nottingham, as well as a wealth of other NIHR infrastructure and NHS research. And I think that we all hear about the sort of northern powerhouse and the south, but actually there's a wealth of really excellent research at the interface of the NHS, social care in primary and in our primary care in our hospitals and in our public health that we thought would really harness from being brought together as part of the Midlands Health Alliance. And now that is working in partnership with MIH and Midlands Engine to form Midlands Engine Health. And I think it's just trying to raise the profile of the excellent health research that goes on in our region.
Thanks for sharing that. So any questions, anyone, regarding the research or any issues connected with diabetes or anything at all?
So I think somebody's asked if the so the blueprint certainly will be circulated, and we're very happy to circulate a version of the slides. I think there are some slides in development, but you can take the ones that I've pulled together and that they can be circulated.
Okay, that's great. Chris?
So Melanie, my internet connection dropped out very briefly, so I hope you didn't cover this in the bit where it dropped out. But at the start of your presentation, you were talking about 10% of the NHS budget being spent on diabetes, and a lot of that on the complications of diabetes. Have you got a sense about, well, if we're going to improve either pathways, care pathways, or the prevention of type 2 diabetes, where would we actually get the best benefit in terms of reducing that demand for resources and all those harmful health outcomes that are occurring because of diabetes?
Yeah, look, it's a fantastic question, and it's a really difficult answer, of course, because clearly your best long-term return is on investing on prevention. We know that, and you know, just in my clinic now, the really scary thing is that these young people in their 20s, 30s, and 40s have accelerated complications, and they're going to have diabetes for decades longer than people that we used to see presenting in their 40s and 50s. So clearly, as we now have better treatments for obesity, as we have better, I think, in lifestyle interventions, the diabetes prevention program has actually been reasonably successful. So I think investing up front in trying to prevent and delay the onset is clearly where we're going to get the best longer term return. But then we still have, you know, certainly in Leicestershire, over 55,000 people who've already got the disease and the condition, and we have to be able to continue to treat them effectively. So it's not about taking funding from one thing and putting it into another, but increasingly the focus has got to be on prevention, because otherwise we're just not going to be able to cope with the number of people coming through.
Okay, I've got a question, and maybe Melanie can answer that, someone can answer that. If all the ICSs in the West Midlands, or in the Midlands, such as the Greater Midlands, cite, and all of them identify in their health and equality plans diabetes, and obviously it's going to vary from area to area, from Rutland to Leicestershire to Birmingham, Worcester, or etc. Do you think we could have a joint strategy or a joint action plan together?
Yeah, no, I absolutely, and I think that was part of so it was great actually when we had this blueprint event that we did get people, and we've got, you know, I would say that we have the strongest group in the Midlands in terms of diabetes. If you look at the people in Birmingham and Leicester, and in fact Northamptonshire has just invested majorly in their team in diabetes. There's some, you know, not just nationally leading, there's world leading work going on, and there's a real, I think, enthusiasm to work together. We don't actually compete, we work quite well. There's already a type 1 network across the region. We have a type 2 network that we've had a first couple of meetings for. So I think in terms of the hospital specialists and primary care and medical side of things, I think there's already an enthusiasm to do that. I think if we could join up the sort of greater efforts around the ICSs and particularly get the sort of public health and community side working together as well, I think it would be tremendously powerful.
So I don't know if I can make a suggestion. If it's in our gift or power, it might be something that we feel up to the Midlands Health Commission, which is chaired by Lord Dictor, who can make it today, or it's something at a regional level. I'm not quite sure whether it's a combined authority or combined authority plus, because obviously there's not everyone's in the combined authority. But is there a way that we could have at a high level, all ICS is making a pledge to work together on tackling diabetes, sharing resources, thinking, know-how, linking into what you're doing that others are doing? I don't know how we would make that happen. Any suggestions? Lisa's come online, so maybe she's got something to say.
Sorry, struggling to unmute there, Patrick. I think in principle, yeah, I mean, it's the biggest health challenge across our country, isn't it? Oh. So you know, doing it collaboratively and showing the learning has got to be the way forward. I think for us thinking about a regional approach, Nigel Sturrock would have the sort of lead for health equalities for regional health. Mm-hmm. So we can certainly get Nigel on board. And then, yes, I think what we just then need to do is think about how we connect in with social care and others to make it properly, you know, three-dimensional and make sure that we're doing it across all the partners. But I think starting to do something, you know, one thing at real scale, yeah, does sound like something we could do. So I'm very happy to pick up a conversation with Nigel anyway.
Okay, that's great. Thanks for that. That was Lisa. She's the Deputy Director of Birmingham ICS. We need to come to a close because obviously we've got some other stuff to cover. But Melanie, thanks so much for your presentation. I think other people online, please think about that. Could it be something that we could do collectively just have some reflections, and maybe it might be something that the Midlands Health Commission can actually put down as one of its agenda items to think about seriously.